thank you both for joining me for this fireside chat, talking about data and food security work and the role of it at the county level and excitement about opportunities around it. So for folks who are going to be watching and still getting to know the Office of the Food Security Advocate, my name is Jamel Washington Rock, and I serve as the program manager with our Director Marketing Lawson, our Research and Evaluation Strategy Manager, Dr. Jenny Schrum, and our Program Coordinator, Rose Laughlin. So I wanted to toss it to you, Zach, and then to you, Dr. Chanel, to introduce yourselves.
Well, firstly, thank you so much for inviting me to participate in this chat. I'm very excited to be getting more heavily involved in food security work here in Somerset County and in New Jersey, and I'm excited to have a good conversation today. As you said, I am Zachary Berliner. I'm the planning administrator for the Somerset County Department of Human Services. And shortly, what that means is I'm responsible for identifying gaps between the needs of the residents and the services and resources that are available to meet those needs. And therefore, given what has been going on around the country, but particularly throughout New Jersey, with the trends of more and more food insecurity being faced by households and individuals, I am very happy to be here talking about this work. I am a licensed social worker, a proud social worker and community advocate. And with that, I'll stop talking and pass it over to Chanel.
Well, hello, everyone. Again, echoing Zachary's sentiments. Thank you, Jamel, for the invitation to join you all on this afternoon. It's always a pleasure to reach out to those who are interested in the topic of food insecurity and identifying ways to help eradicate it in one of the wealthiest nations across the world. I am Dr. Chanel Adams Griffin. I am the administrator for the Office of Health Equity Services here at the Hudson County Department of Health and Human Services, where our director is Doris Toon. And I think we'll get into a little more discussion about what our office oversees, how we're combating food insecurity, and how that connects with health and why it falls under the auspice of this office. So thank you. It's a pleasure to be here with you all.
Wonderful. So, yes, I mean, we can just jump right in. We know we're not going to be able to cover everything in the time that we have together, but we are big fans of leaving the folks wanting more, and then we come back together and pick up where we left off. So, actually, Doc, if you would like to, share a brief overview about how food security work is being housed and held and prioritized at the county level and kind of what you're overseeing, that would be great. And then Zachary, you could do the same.
Okay.
Awesome. So here in Hudson County, we're based in our county seat of Jersey City. And those of you who pay attention to statistics, Jersey City is the most diverse city in the continental United States. So with that, we have a lot of cultures represented. We have a lot of needs to be met, and a lot of voices to be heard. So during the plight of one of the most difficult times of the world in 2021 in response to the COVID-19 pandemic, our county exec, Thomas G's, had highlighted the fact that traveling through the streets of Hudson County, there were these exhaustively long lines of people standing, waiting for food to be able to feed their families. And so our department director was approached with the task of how can we help the residents of Hudson County. So therein lies the creation and the existence of our food security task force. Again, launched in 2021 via executive order, but created to help meet the long-term hunger needs of the residents of Hudson County. Everything that we do is based on sustainability and how can we use this as a catapult to a more sustainable lifestyle, and also how can we tie in the educational piece to serve as a reservoir of the correlation between food and health and how that circumvents this cycle. So our food security task force is made of a diverse representation of residents of Hudson County, of stakeholders, of government officials, of offices that are represented, as well as nonprofits and grassroots efforts. Throughout our task force, we try to help as many individuals as possible. And especially during that time of the pandemic, we forged a collaboration with the Community Food Bank of New Jersey. So there are biweekly distributions taking place to this day. We help with the affiliation process of pantries. We have created resource guides to help direct residents to different pantries in their immediate vicinity. And we also have a plethora of different grant opportunities and funding opportunities to help support and meet the needs of our residents of Hudson County. So the task force in and of itself is multifaceted. And I think as we talk more, a lot more of what we are doing is going to come out through our conversation today.
Wow. It's really an incredible amount of work in a short period of time. And kudos for you for being so responsive to the needs on the ground during what was, yeah, as you had mentioned, can't say it. Unprecedented is the word. I always search for a different one, but at least in my lifetime, in our lifetimes, an unprecedented, public health emergency and human service emergency. And so we are not as far along as you are here in Somerset County. We have had some previously existing coalitions that are addressing food security. There has been work that has been done under the auspices of our Healthier Somerset convening, which is a cross-sector public-private partnership convened by Robert Wood Johnson Hospital here in Somerset County to address all of the social determinants of health driving, the ability of residents of Somerset County to live long, healthy, successful lives. That, however, in response to what we saw during the pandemic and what we are hearing from our food banks and food pantries, which is mimicking that there were lines around the block in 2021. However, moving out of the pandemic, we are still hearing from our food support partners that every single month is the busiest month that they have ever had. There are a variety of factors that I think are driving this, the main one being the cost of housing in New Jersey, and the spikes that have happened in that recently are really, that just puts increased pressure on every other household income. So using the work and the connections that were developed through Healthier Somerset, and also building on a food emergency security task force, which is comprised of our Office of Emergency Management, representation from our Health and Human Services and our food support partners throughout the county. We have begun the discussions to move this separated out and elevate it as its own coalition that is addressing food security here in Somerset County. And as I often say, we in Somerset County, it is health and human services, a double-edged sword in that we are a very resource-rich county, as opposed to some other counties that maybe face more daunting indicators of need and economic indicators. However, so that creates an opportunity to really leverage those resources. And as you mentioned earlier, in a country and as a county as wealthy as ours, there is no need for anyone to ever wonder where they're going to get their next meal and go to bed hungry. And particularly, I think it is a moral failing that we have children going to bed hungry. And we are lucky enough here in Somerset County that if we can get this right and break down silos and leverage the resources that are existent on the ground in an intelligent, coordinated way that I feel that is driven by and gives voice to the residents who need these services, then it is an achievable goal to get to zero food insecurity in this county. What else did I forget to talk about? So as of now, we are just now where we are in our coalition through the support and the work with the Office of the Food Security Advocate of New Jersey. We are now going to be able to develop, and we'll begin within a month working with the Trenton Health team to develop a really good data set that will allow us to identify the regions and specific down to block group areas of Somerset County where there's the highest probability of food insecurity. And that is really exciting because that is going to drive the discussions of this coalition moving forward and the work that we do to try to address this.
So if I can hop in for a quick second, I also want to share for folks who are going to be watching that I appreciate you, Zach, shouting out Hudson County and saying Somerset's not quite as far along, but yet we wanted to make sure that we let folks know Somerset County and Hudson County are among the leading counties doing food security work in the state. So this is why we brought you all together. Yes. So applause to you and to the others who we will continue to uplift and highlight going forward. You did start to talk about Trenton Health Team. I wanted to, let's talk about where data comes into this as a process of really identifying what needs are, also providing insight maybe for those who want to. Denial is a hard word, but I'm at a loss for another word right now. So denying that there is a need perhaps in the county or in certain communities. And we know that there's need in every community, right? There's always opportunities to improve health equity. And I love that you both mentioned social determinants, and they're all interconnected. And food security work can be or is primed to be a beautiful entry point to help provide wraparound supports for families and individuals and really transform lives for generations to come. So one thing I did want to also say and ask about, and I did kind of warn the two of you. So for anyone who goes, what kind of question is that? Doc, you mentioned something when we recently gathered in person that I thought was fantastic, and I really would love for you to expound on it. Talking about when it comes to data collection, what are some ways or ideas or considerations so that we're not exhausting these communities who are already feeling perhaps that extractive practices have already come through? Maybe they don't feel ownership of the work, because I know that speaks to Zach's heart and commitment in doing this to make it a participatory process. So if you could share a little bit about that.
I
was going to say, Doc, you can go first. I'm like, oh no,
I'm No, okay, so I can go ahead and jump in. I think in terms of Hudson County and operating or serving as the administrator for the Office of Health Equity, we operate in a certain notion that everyone must understand what equity is, right? And it's not the same as equality. With equity, we are removing barriers. Yes, all of the services are there, all of the services are available. They're designed to help everyone, but through the lens of equity, we are making sure everyone has an opportunity to reach what is needed for them. And so that's where the data comes into play. And based on my background, I am a trained microbiologist. My doctorate is in food microbiology. So I am accustomed to gathering data, taking that data, how can I tell the story? But I also operate under the notion that we sample once and use often. When it comes to food insecurity, you have people that are in a very sensitive place in life where they are facing income inequities, and they have to choose, am I putting food on the table for my family, or am I sacrificing a place to live? And so through the lens of dignity, we are trying to utilize the data that has already been collected and design programming to meet the needs of the residents of Hudson County. So as our food security task force was created in 2021, we kicked off with a needs-based assessment. So in partnership with New Jersey City University, a survey was created, QR code generated, and a survey distributed throughout the county. We yielded just slightly over 10,000 responses. And the way that we did this was using a multi-pronged approach. So again, taking your data set, but diversifying it not only in terms of sample, but also distribution. Who has access to technology? Who's comfortable with using that technology? And if they aren't comfortable, how can we meet them where they are by having paper copies available? We also know that during the time of the pandemic, this is an opportunity where people were visiting vaccine sites. So for the county, the vaccine sites were visited during that 15-minute wait period to make sure you were okay. The survey was distributed, the QR code scanned, and individuals were either using a tablet that was provided by the county or using their smartphones to complete the questionnaire. And that was used as the guideline or the framework for our food security task force and the initiatives that we would tackle head on. We know that there is a lot of work to do, but working at the county level, the data supports the drive. And so if we do not have the feedback from the residents, if we do not know the areas of need, we do not know how to tackle and address. So by doing this need-based assessment, we were able to use that to help structure the framework of the food security task force, but to also reassure the residents that we are here, that we see you, that we are meeting you where you are, and we are trying to help alleviate some of that pressure that comes with the day-to-day life. So again, in terms of data collection, utilizing the resources that we have at the county level at startup, that data that already existed through census tracking, but also using national data. We know that this is now on the radar of the White House, right? We know that there are social determinants of health identified in Healthy People 2030. And so with this national lens on social determinants of health, we know that this is the foundation of food insecurity. If you don't have the nutritional content and the nutritional value, if the stress is coming in, if the environmental factors, the neighborhood or place-based factors are impacting your ability to navigate and to thrive and survive, then you in and of yourself will not be healthy. And that also means that your family is not going to be healthy. And Jamel's, as you alluded to, it becomes generational. So how can we use the data to break these generational trends and utilize the resources at the county level to meet the needs of the people?
Thank you. Go ahead, Zach.
Yeah, first, I just want to thank you. And when I heard you say it last week, I was not. You probably was doing it again. You'll see it on the video, just nodding my head. This is something that it is. Whenever I am working with younger people in this field, one of the first things I say to them is never ask someone a question when you don't know what you're going to do with the answer.
I like
And
that.
that really reflects that I mean, and I'm a curious person. I'm always looking for different correlations. So it was hard for me to learn that. I always want to ask the follow-up and just see if I can, but to respect people's dignity, their autonomy, their privacy. And I think too often in this country, in order to access safety net services, vulnerable people who are suffering from trauma, who are in crisis, their autonomy and their privacy is not respected to the extent that it should be. And so, and as a corollary to that, it really behooves us to make sure we have squeezed all of the juice out of our data sets before we start going back out and asking more questions. Because I think that it does appear to certain communities and higher need communities that, I keep answering these surveys. what what is coming to us from this?
Yes.
What is this driving? What decisions are this driving? How is this impacting our lives in real time? So I think that if there's, from listening to this conversation, I hope people will take a lot more away from it. But I think actually if there's one point that they do take away to really frame how they're entering this work, I think that is a really wonderful point that you just made.
And I think we also have to take into consideration that people, when they respond, we want them to be genuine. And if they feel as though you continue to approach them, it becomes, I'll just tell you what you want to hear.
Yeah.
And so how relevant is the data at that point? So I think that also has to be taken into consideration.
I think very much so. And that's, Jamel had mentioned this, and that really feeds into where we are with data, is to initially use the publicly available census tract data, public determinant health information that is available from the federal government mainly, but some other larger sources, and use that to identify the areas where we need to have these further conversations and really start to look at what is driving economic and therefore food insecurity in this specific area. But just because the numbers tell one story, we know that it could be something completely different that is a real lever that is driving this. So it's, once we have identified these areas, how do we then go into them, identify stakeholders that are already, informal or informal ways doing work on this to help their neighbors and their community members, and listen to them and bring them into this process? Because to your point, the answer that someone is going to give me as a stranger in their community, who very often, because as you said, there's an equity factor to this, Black and brown people are more likely to be food insecure by a pretty significant statistical point. Someone is going to have a more honest conversation with someone that they have a relationship with, that they know, and that they know is a member of their community and has their best interests at heart, than an outside entity who is giving help. I think there's just a lot more rich data that can inform localized programming that really meets the needs of that community. I think one of the most exciting things for me, and it sounds terrible to sound exciting, it probably isn't the right word, but about this food security conversation, is that I think that the conception of what food security is expanding in a way that it really incorporates a comprehensive view of social determinants health, of community health. And it's a really effective lens to speak about all of these contributing factors, about the lack of affordable housing, the lack of public transportation, educational equity as a driver of economic insecurity. If we frame this with food, it is so basic to our needs and our understanding of security and our understanding of family and culture, all of this, it's so related that if we want to tell a story about need in this country and in New Jersey and in Somerset County, talking about it through the lens of food is a way that everyone will get it. And often that is a struggle that we have to communicate, because it isn't one thing and everything is interrelated. So having this as a way to discuss and present out to the entire community of speaking to denial. I mean, this exists if you want to know more of what driving, but the end result is this many of your neighbors went to bed hungry. That's a compelling argument to move to bolster resources and efforts around this. And that all starts with good data. Because in order to bring people to a conversation, you need to have proof of need.
Go ahead. I was going to say, you please feel free to speak freely. You don't have to be. Go ahead, Doc, if you wanted to respond.
No, I was going to say I agree on all fronts. You know, and I think also as we talk about the availability of resources, and sometimes the perception that's associated with the county in which you reside and how your zip code dictates access to resources, and different avenues, even as you spoke to Educational Inequities Act, being able to understand what it means to have a nutritious meal and how that drives you throughout your day so that you can pay attention and you can focus in school and you learn the necessities to maintain throughout life. Um, and I think that's all the work that we're doing from the state level with OFSA, or the Office of Food Security Advocate, over to Somerset County, to coming up north to Hudson County. It's trying to make sure the data that is obtained is used to introduce educational resources back into our communities so that those individuals throughout New Jersey and across the United States and beyond understand the importance of food insecurity and that there is real stigma associated with it. And if you are living in that zip code that has an affluent background, that I can't drive up to this pantry and, this vehicle, what are people going to think of me? What are my neighbors going to think if they see me coming back with a cart or a box of food and produce, filled with canned goods or box goods, and they know it's shelf stable? So it must have come from a pantry. So how do we maintain people's dignity by using the data, the zip codes, and using, I guess, small nuances based on what would gain their comfortability to really speak out, concerning their need?
There.
And I just wanted to add before I forget, looking down at my little notes, my notes that I made, and whenever I do one of these at the end, I'm like, and I didn't say that, and I didn't say that.
I agree.
One of the things that I said that really started to draw me into this discussion here in my role in Somerset County. I have only been here for 2.5 years. Some days seems like a day, some days it seems a little bit longer than that. One of the most significant barriers that residents of Somerset County, and this has been identified in every needs assessment that has ever been done by this Department of Human Services, is a lack of public transportation. The barriers of being able to access the food support, access a grocery, and access information and services on a wide variety of needs. Therefore we have started to look about how we can bring those services through mobile units directly out into the communities that are have the most need, are the most isolated. So to bring the information and services into the most vulnerable communities around the county. And through that effort, also would like to bring food support into those areas that we know are the most isolated food deserts with the least available food support resources. So that's when I first started looking for data to drive this and reached out. We are partnering with the Community Food Bank of New Jersey, has been a really great partner providing food to our local Somerset County Food Bank network to distribute through these mobile initiatives. But really, that's where I started looking for data on a micro level in the county to really be able to target these, and it wasn't existent. And we had a really nice confluence of events. Is that right about the time that I realized that I met Mark and Jamel's and Dr. Jenny, and they were able to facilitate conversations with the Trenton Health team, but also with other people who have already done this work to help get us to where we need to have the data to really develop the part B. It's like, now you know the need, but that's the easy part. As hard as it seems sometimes to find that need, as everyone's car knows. That's the easy part. What do we do with it next? And this is really pressing stuff. There are people that are hungry right now, but you need to take the time to have conversations out with, and to make sure that what you're doing is going to meet that need. Rather than, I think very often for me, I know I really do feel the pressure that I try to always remind myself when I'm looking at numbers. I make a practice of like painting a picture of a family that I know, or people that I know, to really internalize, like to really like give voice to this data. And when you do that, you feel a pressure of like, I would love to get in my car and just go drive food around forever, but I got to do something right now. We're getting, and that can work politically as well. We got to do something right now, but to really take the time to build the coalition, get the right people at the table and the right voices at the table to help drive this, is how, as you had referenced earlier, you're making a difference generationally down the line. You're not, so it is, that, to your point, data needs to drive all of this. The resources that we have very often in communities throughout New Jersey and in the country, the resources aren't sufficient to meet the need. So we really need to make sure we're using those resources as intelligently and effectively as possible.
Awesome. Thank you, Zach. I know that we're almost coming to time, so I wanted to, I have a question in mind, but I wanted to give the two of you a chance to just ask each other, county to county, particular questions that you may be thinking about as well.
I've got one right off the bat. I've got, how did you get such a fantastic response rate to that survey? Were you handing out $20 bills?
So just like you, Zach, I am still fairly new to the county. I started July 2022. So the survey was conducted a year prior to my onboarding and my arrival. But just through conversation, it was being tactful. I think the best strategy in any approach is always going to be meet the people where they are. And so if during that time we were going through the pandemic, vaccines were being administered, there was a 15-minute wait time, let's station there. If we know the county already contracts with agencies that service a senior population, for instance, they may not be as tech savvy, let's partner with them, drop off some paper surveys to them, allow for them to distribute to the clients on their roster, and we'll get that feedback. We give prepaid envelopes, just please mail it back or email a scanned copy back to the office. So certainly trying to be as relatable to the population you're attempting to reach as possible. I think you have some great work going on in Somerset County. You have, I think last week it was spoken of, different agencies and partners that come together and meet routinely. So looking at the populations they serve, how can we partner? Is there a community event, taking place? And can we drop off some surveys, or can we just put up a poster with a QR code? So it's going to have to be able to be as, I guess, flexible in your approach as possible. There's no black and white answer to it, I don't think.
No, there was one. But congratulations. However, that is as someone who has done a fair amount of this, that is a fantastic response rate.
Thank you. We have a great team.
Great,
we have
response. So that is a lot of data. There's a lot of information there. Very rich data.
Yeah. And I would just say, Zach, to you, being in a county that is resource rich, what do you think will be your approach in getting responses from people? I know you would like to have as much data as possible. Have you thought about any logistics about how can you bring people in and draw people in while still maintaining their confidentiality?
Yeah, I mean, and I think that when I think about this, you spoke to it, about we for Somerset County, our nonprofit and safety net organizations do work very well together comparatively. There is more of a sense of collaboration and collaborative effort than competition, which sometimes can affect that. So that being said, we have really strong partnerships with agencies that have been located and building trust and working with residents and communities for a much longer time than any of us. So relying on their two things. One, asking them to assist with the work, because the trust that they've built is going to be invaluable in getting really rich data, or getting data, a response. But also, relying on their expertise to develop the plan of how to do this is how I would think about it. I through these mobile initiatives of getting out into communities where using census level data, we know there is more economic need and insecurity. When we are out there, I think it's always helpful, one, to bring something, whether it's a vaccine. I mean, I think that it's an opportunity. So if we are out providing a tangible good, as in a mobile food distribution, we're using a model of a mobile resource fair. In our last needs assessment we did in the county, we identified lack of information about existing services as the major
That's
barrier.
every county, I think.
Every county, and that was the largest one statewide. That seems like something we can do something about. You know what I mean? And so we're bringing the partners, we're bringing our public transportation partner who is providing bikes and bike safety for people without cars. We're bringing our public health, community-based health center partners out. The people that already have had long-term presences in communities. And so by having a draw of something that is having the kind of that immediate impact I was talking about before on people's lives, I think that that is a really good opportunity to have conversations and to collect information specifically where we need to. That and beg, borrow, steal. Get our partners, many, that our partner agencies and our government agencies, none of us really have enough hands to do this in a comprehensive manner, in addition to the other 10 other hats that we're wearing on any given day. So, relying on them and trusting them to be full partners in this process, I think really will help that as well. I don't know if I answered your question in the slightest.
You did.
Good. I'm glad. I was attempting to. It's difficult because the stigma is real, and where there is less need, and we certainly have communities that are high need communities here in Somerset County. I want to say relatively, me thinking of Somerset County as which is resource rich. It is a wealthy county. It makes when there is so much wealth, there still are 10 to upwards in population of people that are living below the poverty line. Yes. So it actually makes it more stark. It makes the stigma stronger in a lot of ways. And so that is something that you need to have trusted partners, because people don't, in those communities and in those environments, admitting that you are food insecure, I do feel that it might be a little bit harder to get honest responses. So therefore, you really need to find their trusted partners.
Yeah. And we're here to help however we can.
Yeah. And then for you, it would be, I guess, as you've looked and gotten this larger, more accurate picture of the scale of the need throughout the county, and your coalition is looking at this, do you have any best practices or suggestions for how to take a comprehensive look at all of the resources that are available, and maybe break down some silos between different agencies that have worked in this area that have this amount of resources, and this agency has worked in this area and does this? Because I think it's streamlining and leveraging our food support resources. There's a lot of duplication that goes on about. That's one of the real powers, I think, of a coalition or task force like this with everyone at the table. But is there anything that you've seen that helps move that conversation into from that kind of individual agency into a collective we?
So I think in that approach, when you have so many great ideas and so much data to work with, we broke it down into subcommittees. So we have a committee on improving access. We have a committee that looks into community gardening, and then also just overall approaches and advances throughout Hudson County. Throughout those subcommittees, we're able to tackle smaller initiatives so that we keep the needle moving in the right direction, and reduce the presence of stagnancy. So through that, again, we've been able to branch out through our lens of food as medicine. We've secured grant funding from the USDA. I believe we are the only county in the state of New Jersey that is operating a Gus Shoemaker Nutrition Incentive Program. We have the produce prescription in collaboration with our federally qualified health centers. So that's how we're improving access, right? Meeting people where they are. So health outcomes are improved. Those diet related chronic illnesses. We have our collaborative extension with Rutgers University, that county agreement. Somerset has one as well. So
Yeah.
using that arm to do the nutrition education, to also aid with the community garden, the teaching the individuals of how to utilize your space to grow the produce, to help grow some of the things that may be more expensive in a grocery store, but you still need it on your plate and in your households. So kind of just using the individuals that are at the table, the gifts and talents that they have, and how can we bring that into the county, divvy the work out? Because to your point, we're all wearing 10 and 25 different hats and only have a limited amount of time. So I think as Somerset County's coalition grows out, being able to identify what are the top priorities, how can we branch out our partners at the table, these stakeholders, our nonprofits, our grassroots, and tackle some of these primary areas of need.
Well, thank you very much.
You're
It
welcome.
makes a lot of sense. It's as you are speaking, I'm creating a to-do list. Do
Well,
that.
just call me. We can talk
Yeah,
it through.
I certainly will. Certainly.
Well, and I was going to say, Doc, if it's not too déclassé, I would love to invite Zachary to crash a Hudson County task force.
Yes, please. I think we should
I
send it
would
out to
I
all
would
of the
love
counties
that.
that were represented.
Yes, yes. Okay.
So
So
January 29th is our next meeting.
All right. I'm putting it on the calendar.
I think. Let me make sure.
Yeah.
So, well, I appreciate you both. This is certainly not the last time we're going to get together and chat more, because I would also love to kind of go into opportunities around data sharing as well with the partners who are participating and helping to deploy any surveys or gather any input, and how those results are shared out. And I just want to say, I keep seeing the theme and the of agency as well, agency for community members, whether they participate and how they want to participate in offering input, about their story, this moment in their story, but then also agency of community partners as well to be able to talk with county administrators and feel as though their voice matters and their expertise matters as well. And I think that that's something we're seeing in other spaces too, so that people really feel like, well, the power, let's readjust these power dynamics so that if you say I have a voice, I'm appreciative of this opportunity, but now true partnership means that I'm going to really be able to express our expertise and what we've seen, and have it be appreciated and valued in return. So I've been loving this conversation the whole day. I want to thank you both. And I want to thank everyone who's going to be watching this in advance. And sorry, not sorry if you get emails from folks. I mean, this is part of the goal of the office, to really shout out best and brave practices and really continue to build this movement of getting everyone to a point of being food secure, economic secure, because it's not just about the people who are in need at this time. It really benefits all of us. So